Remote working and virtual health are two topics that are very relevant today. This is something that some organizations have been doing for a long time, and many organizations are now looking at implementing remote workers and virtual health solutions in response to the COVID-19 pandemic and the response for your healthcare, medical, dental, chiropractic practices. So there are a lot of questions about what is appropriate, what can you do, and what steps that you need to take. So we've recently published a checklist about remote workers, and as part of that checklist, we've identified some steps to help you document your decisions about remote working. The other side of this is that you also need to establish what are the risks to remote working and decide how you can mitigate those risks and whether or not that is a risk that you want to undertake. And that's all about doing a privacy impact assessment. So I want to share some very current information with you about that process, and then we're going to take a look about actually creating that risk analysis for remote working and virtual health.
Welcome to Practice Management Nuggets Podcast, practical practice management and privacy tips to help you start, grow, and improve your healthcare practice. If you are a clinic manager, team lead, healthcare provider, or practice owner, these practical tips will save you time and money. My name is Jean Eaton, your practice management mentor and your practical privacy coach with Information Managers. I help you manage the pink elephant in the room. Let's get started.
So, privacy and security risk mitigation is a step in every privacy impact assessment. And you should have policies and procedures in your organization that identify that prior to implementing any new project, you will complete a risk analysis. This is an expectation of the Health Information Act legislation in Alberta and all privacy legislation throughout Canada. So regardless of which privacy legislation you fall into, they all require the custodian or the clinic owner to do a risk analysis before potentially identifying information and specifically identifying health information in a new way. So your policy and procedure should identify what your expectations are as an organization about doing a risk analysis. So you may have a policy that states something like this. Risk may be mitigated through the deployment of controls which will lessen either the likelihood or the consequences of harms as a result of the risk. Mitigation measures includes reasonable administrative, technical, or physical safeguards that protect the privacy and security of personally identifiable and personal health information that the clinic collects, uses, and discloses. In addition to mitigating the risk, an organization can choose to avoid the risk by not undertaking the activity, transferring the risk to another entity, or accept the risk. So this is a really important step. There are many good advantages that you may realize if you do remote working, for example. But if you go through the risk analysis and identify that this activity about remote working in these circumstances with these employees, with these equipment to support them is a risky move, then don't do it. So just because we are in a pandemic situation, there are risks that you might decide that you just don't want to assume. And what I really want to caution you is don't be rushing to accept those risks. If you've got a situation where you've got some risks that really makes it difficult for you to sleep at night, but you could apply some new hardware or upgrades to your system that would make it less risky, then take the time to do this right. The pandemic will last a while, but it won't last forever. So you want to make sure that you are taking reasonable risks, because the bad news situation about having a privacy breach with patient information is just not worth assuming a risk that you anticipated might happen. So if you're not in a life and death situation with a patient, and most of our cases in primary care are not, then you probably don't want to assume those risks. So we're going to talk about that in our training episode here today. Now, one of the roles of the privacy officer is to make sure that risk assessments are done as required. So the responsibilities of that privacy officer is to identify changes to workflow or technology which triggers a privacy and security risk assessment. So ideally, the privacy officer will be notified about the project, but often we just hear about it, and that's one of the reasons why we have the privacy officer on the very important role in the organization, where you're close enough to the front line and close enough to the decision makers to hear if there are changes that are being considered. The privacy officer will ensure that a privacy and security risk assessment and mitigation plan is completed. The privacy officer will review the risk and mitigation strategy for completeness and contribute to its documentation. The privacy officer will ensure that the custodians are included in the review of the privacy and security risk assessment and mitigation plan for the project. So this is really critical. Now, I know that a lot of privacy officers and clinic managers look after all of the administrative side of things in their clinic, and their physicians or the custodians are not directly involved. However, this is a decision that the custodian must make. So you can do all of the grunt work, but you must bring it to the custodian to say, we've got a solution that we think is going to work for remote working. I'd like to walk you through it and get your approval to go ahead with this project or make a modification to it. And then you need to have the custodian sign off on it. So you actually need to make sure that you have a written signature from your custodian that they agree to this implementation plan, that they reviewed that risk mitigation. Don't make the assumption that as the clinic manager or the privacy officer, you can go ahead and implement without your custodian approval. That doesn't necessarily mean that every custodian in your organization needs to approve. You have a decision-making plan in your organization. Many clinics have a lead physician who is authorized by the other custodians to make these types of decisions on their behalf. If this is your situation, then you need to get the approval from that one lead custodian. So make sure that you're following your organization's approval process. So the custodian must make the decision to implement the project, and then it becomes the privacy officer's role to record the decision and implement the mitigation strategies and ensure the appropriate review. So when you're starting a new project, you want to review and be on top of that implementation on a regular daily basis when you're just getting the project started. As the project rolls out and you're testing and making sure that things are implemented as possible, as required, you do the review once a month, or perhaps eventually to once a year, once you're in a stable environment. So use that appropriate review process. Now, I really like the quote from Chris Hadfield about risk mitigation. Anticipating problems and figuring out how to solve them is actually the opposite of worrying. It's productive. And I want you to be productive and proactive about managing the risks about remote working and virtual health. Now, just as a reminder, there are 3 types of safeguards that we need to consider when we do risk management. Administrative safeguards are generally those things that we have in writing, like making sure that we've got an appropriate policy and procedure about risk mitigation, that we have oaths of confidentiality, and that we have documented and submitted privacy impact assessments when necessary. Physical risk includes those things that we can touch and see, manipulate. So it might include having paper records. It might include having two-factor authentication and managing the key fobs. It might include having restricted work access, so people can't overhear your phone conversations or read the information that's on a screen. Security or technical safeguards often talks about computers. So it is your computer networking, your antivirus, anti-malware, your secure VPN. But remember, it also talks about security for other things. So it might be the security of your remote workers' working space. Is it in an office with the door on it? Does that door have a lock on it? As opposed to working at the local Starbucks coffee shop. It might be security about your voicemail system and accessing your voicemail system. So we've got a number of safeguards, and we need to make sure that we address each of those safeguards in our risk management plan. When we look at the risks, we want to take a look about what are the bad things that could happen. What could happen if somebody is working from home and somebody in the family overhears a conversation? What other types of bad things could happen? What is the likelihood of it happening? So if the kids are home and the spouses are at home and you've got a remote worker working out of the office that they've set up in the bedroom for this short time period, how likely is it to happen? Well, it's probably pretty high. So if it did happen, how bad could it be if you didn't have those mitigation strategies in place? So if a family member overheard a conversation with the mom who's working at home as a receptionist and is answering the phone for the clinic, how bad could that be? Well, you could be sharing personally identifying information about the clinic, and they might overhear that conversation. So it could be pretty bad. So you've got a high likelihood of something happening, and you've got a privacy breach that could definitely happen. So those are both a high likelihood and a high risk. So that's something you absolutely want to make sure that you've got a solid mitigation plan. So how can you prevent those types of things? Well, in this scenario, you might have the person who is receiving the phone calls using a headset. So it's not on speaker telephone. It might be that they're working in a room that has a closed door on it. There might be some background music to obscure the opportunity of overhearing that conversation. So in a risk assessment, you are looking at what is the risk, how likelihood is it that it might happen, and how bad could it be if you didn't have good mitigation strategies in place. Okay? So we've produced a new practice management success tip called the Remote Worker Privacy and Security Checklist. So if you haven't already downloaded this, please make sure that you do that. It'll be in your show notes in the Q&A session here on Rizuku. And you can go to the website, informationmanagers.ca, for the most recent blog post, and you'll find the link to be able to download this. So in the checklist, we've identified a number of things that you want to make sure you've asked good questions so that you can document what those answers are. Now we're going to use some of those points in creating our risk mitigation strategy table. Now, every time that you do a new project, whether it's remote working or virtual health or video conferencing or having a new security camera in place, you want to look at the risk descriptions. So in healthcare, you want to identify each of these categories and make sure that you've included it in your risk matrix. What is the risk of breach of confidentiality, disclosure of health information, excessive collection of health information, inaccuracy, inappropriate access, loss of information, and unauthorized use. So those become the questions that we're going to ask as part of our risk management strategy. Now, we have risk levels, and the legend or the process that I use for determining levels is low, moderate, or high. So low is the possibility of the risk will occur once or twice a year if no measures are taken. That they would not likely result in a significant harm to the privacy, safety, or economic standing of individuals or the corporation. Moderate is that it will likely happen if at least once a month. And high would be that it would near certainty that a bad thing would happen if those corrective measures or mitigation measures were not in place. So in healthcare, when we're talking about identifying health information, the risk level is nearly always high. Now, this is an example of the risk matrix. So for the project of remote working privacy and security risk assessment, we've identified the different risk categories. This is the category, remote working. And then we've got the different risk categories: breach of confidentiality, disclosure of personal information, excessive collection of information, inaccuracy, and so on. Then within each category, we've got the checkbox for the likelihood, the risk description, and the mitigation. So I'm going to change my screen to my Word document where the blank matrix is there, and we're going to work through a risk assessment for remote working. Okay. So this template is available to you in the course. It's a blank template that you can use for any project, and we're going to work on this for privacy and security risk assessment for remote working. So let's set up the scenario. You've got your administrative reception staff working from home, and they are going to have remote access to the electronic medical record. And their role is to do the appointment confirmations. So the appointment reminders, they're going to make a phone call from their office, home office, and they are going to then call patients on the appointment list for the next day or two to check to make sure that the patients are still want to come to the appointment, that they are not sick, and that you're going to give them additional instructions about coming to the clinic. So they're going to have access to their EMR remotely. They already are an authorized user of the remote electronic medical record, but they will be accessing it from their home office. And let's make this easy and say that the clinic has a laptop that they've been using in the clinic. It's been authorized for clinic use, and the employee has been authorized to take that computer laptop to their home office. They're going to connect through their home Wi-Fi service, and they're going to access the EMR, which is on a web server, and that they are going to have access to the telephone system. Now, the telephone system at the clinic might be a challenge. So with some voicemail systems for land-based telephone systems, you can authorize the individual to have an authorized use of voicemail. They log into the voicemail system of their telephone at the clinic, and then from the voicemail system, using the dial pad and using menu items, they can actually dial out from what appears to be the clinic, even though the employee is working at their home-based office. So on the call display at the from the clinic, when the patient receives the phone call, it comes from the clinic's phone number. Now, your scenario might be quite different, but for the purposes of us completing this form, that's the scenario that we're going to have in place. So the employee working from home, what is the likelihood of having a breach of confidentiality? Well, I would say that it's probably pretty high because their family is at home. The risk is pretty high. So what is the risk description? What is the risk that could happen? It could be overhearing telephone conversations. with the patient. Okay, so what is the mitigation strategy? We've got 3 layers of strategies, and each time that we have a risk that we want to identify, you probably should at least consider whether or not there is an administrative, technical, or physical control. So an administrative control would be, first of all, having an oath of confidentiality. With the employee, acknowledging privacy policies and procedures. Physical control, that they will use a headset for telephone. And a technical control is using the clinic's voicemail messaging system. The employee will dial out from the clinic system to the patient. So that helps to provide reassurance to the patient that the clinic is calling, not somebody from their employee using their personal cell phone. And that way you don't have that the phone log on an individual's cell phone, which creates phone logs on clinic equipment, not employee cell phone. Okay. Now, there might be other things as well. So overhearing the telephone conversation, you might have phone calls, employee has a home office with a closed door to reduce opportunity to overhear conversations by unauthorized. Okay, unauthorized, and music in the background helps to mask conversation. Okay, so we've identified a risk about a breach of confidentiality and some of the mitigation strategies, that the employee has an oath of confidentiality, acknowledging privacy policies and procedures. We've got some physical controls and we have some technical controls. There may be others, of course, as well. So disclosure of personal information. So would the employee give this information to somebody who shouldn't have it? So how could they do that? So the disclosure of personal information, so it might be unauthorized person, individual, disclosure, unauthorized person. Appointment reminder. To an unauthorized individual. So the administrative control for this may be the policy and procedure regarding voicemail messages to voicemail messages. So they're not going to leave a voicemail message on a phone that somebody else in the patient's family may have access to. So there's an existing policy and procedure in place, but without that policy and procedure in place, if the individual didn't know that, would they have left a voicemail message? And somebody else might have captured that information inappropriately. So disclosure of appointment reminder information to an unauthorized individual. There's another opportunity here of health information on the EMR is viewed by unauthorized individual. I know typos bother me, and I'm sure they bother you. So as far as physical control, the employee has a home office with a closed door. With a closed door to reduce the opportunity to observe EMR screens by unauthorized individuals. So we have the policies and procedures. The employee knows that they have to close browsers before stepping away from an open session on the EMR. Technical controls might also be that the printing at remote locations is not enabled, so that the employee can't actually print an appointment list. Okay, so I think you're getting the idea about how you're going to complete this risk mitigation table. You're going to do this for the excessive collection of personal information, inaccuracy of health information, and so on. And you're going to complete this risk mitigation table. Now, this is part of your PIA process for the new project that you're putting in place for remote workers and virtual care. You're going to take the same steps for virtual care as well. Now, because virtual care may also be done remotely, or virtual care may be done at the clinic, but you have to go through the same steps about identifying the risks. Now, during this time period of the pandemic, there is still a requirement that the custodian must identify and document risks and mitigation strategies. Is still an existing requirement that a privacy impact assessment must be submitted to the Commissioner's office in Alberta prior to implementing a new project. Now, the Privacy Commissioner has made a statement in their notice on March 19th that says that the Health Information Act, of course, still applies. That law has not been rescinded. You must still do a privacy impact assessment. However, they are trying to facilitate a way that they can fast track that. So in your current privacy impact assessment documents, in your current policies and procedures, have you addressed the opportunity of having a remote worker or doing virtual health? So maybe that is having video conference calls. Do you have an EMR that allows you to use a patient portal? Do you have phone calls or telephone consultations with your patients currently? So what can you leverage in your current policies and procedures in your current PIA to say, we've had this functionality with our EMR previously, or we've had the opportunity to have people access the EMR through the web browser remotely, but now we're using it for a slightly different purpose. So leverage what you currently have, refresh the information to say, now that we're looking at it from a different perspective for a slightly different purpose, we have confirmed that we're doing this, that, and the other thing, but we're not doing this. We have identified that there are risks, and this is how we're going to mitigate them. The custodian has determined that on the balance of probabilities and the requirements to be able to respond to our patient needs for the pandemic purposes in particular, that we have determined that we will implement this project for a certain time period, that it will be monitored closely by the custodian and the privacy officer, and then you submit that privacy impact assessment submission to the commissioner's office. So they are positioned to be able to review those PIAs quickly. Now, this PIA process might be a cover letter that identifies your project. Use the checklist that we've provided to you in the template to help identify those risks. Create your risk mitigation strategy here. That will go a long ways to help you anticipate risks and put plans in place to be able to mitigate those risks. Then you're going to do that documentation and submit it to the commissioner's office. You can submit that information to the commissioner's office by email. And of course, you're going to make sure that you do the appropriate training with your employees. So you're going to go through and pull all of those current policies and procedures that are directly applicable, make sure that they review them, make sure that your oath of confidentiality is up to date, or if it's not, now's a good time to renew it. Make sure that you talk with your IT support person to make sure that the technology is in place. So it's certainly easier if you can provide a clinic owned laptop for the employee to use from home rather than the employee using their computers at their home where everybody else might also have access to the computers. And you might find that this is a solution for one or two employees and not everybody. And you can pick which employees are appropriate to do this. Somebody at home that doesn't have Wi-Fi is probably not the most appropriate employee to be able to give this opportunity to. And there are still a lot of people that don't have Wi-Fi. They borrow Wi-Fi from their neighbors. I see that very frequently. So make sure that you are addressing the risks and documenting what questions you've asked and how you're going to answer them. The same scenario applies for virtual healthcare. If you are going to implement new technology, for example, a patient portal, or actually use some functionality with your EMR that perhaps has been there for a while, but you've never really implemented, having secure email conversations with your patients being an example, then go through these steps and make sure that you have things clearly thought out. You also need to make sure that you are consenting the patient so that they understand what this new strategy or implementation is, to let patients know that they can contact their doctor using the patient portal or the telephone. The telephone works quite well. So you need to make sure that your healthcare providers have access to the EMR so that they can document that process, document that patient's care in the EMR in a timely fashion, or by paper and having it transposed to the EMR as quickly as possible. So there are a lot of options for you to consider, and this is a great way to use that risk mitigation table to clearly document what it is that you've considered, make sure that those policies and procedures are updated, and at the end of the day, make a decision about whether or not you are going to go ahead with these new changes to remote working or a variety of different virtual health options. So I hope that this review about setting up a risk mitigation table has been of help to you, and specifically reviewing your risk mitigation plans for remote working and virtual healthcare.
Did you hear something on today's podcast that you would like to go back and listen to again? Or maybe you heard something on one of our previous podcasts, but you don't remember which one, and you'd like to be able to find it quickly and easily. Well, that's easy to do now. If you heard something on this podcast that you want to revisit, go to practicemanagementnuggets.live/search and enter the keyword in the magic box. You will be brought back to the podcast at the exact spot where we talked about it. This video keyword search tool uses the new Searchy app. If you would like to know more about this, visit informationmanagers.ca/likes-searchy. That's SEARCHIE. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below. When you leave your review, it helps people who like what you like to find this podcast. Until next time, this is Jean Eaton, your practice management mentor with Information Managers.